Hello, everyone, and welcome to another episode of the Provider's Report. We're going to be talking about clinical pathways, systems, especially when it comes down to operations in healthcare. And we have an incredible guest, Dr. LouAnne. Thank you so much for joining us.
It's great to be here with you, Dr. Rebecca.
Wonderful. Do you mind just first telling our listeners a little bit about you? You've had a pretty eclectic journey through healthcare and you've accomplished so much, and you've really spent time in varying areas of healthcare. So I'd love to hear more.
Absolutely. So, my clinical background is I'm a board certified physician in emergency medicine. And during my time in the emergency department, realized that there were a lot of systems that came into play. So, whether it was the outpatient world and how it intersected with the hospital through the emergency department or coordinating care within inpatient units, that there were really a lot of great opportunities out there to understand how systems work. So, in my first position, I developed an interest with the IHI's quintuple aim too, and thinking about not only how do we improve population health, how do we make sure we're reducing cost where we can, how do we make sure that we're caring for the people who care for the people, as well as create a really great experience for our patients, how are we kind of building in health equity. And so with that path, I've had the opportunity to see healthcare from a variety of different lenses, from the payer perspective and what payers are looking for to be able to improve population health, what it's like at the health system level as a health system CMO, and have worked in a variety of ambulatory settings and urgent care, and now in a federally qualified health center, and have worked as a consultant and coach with a variety of different companies as well.
I love that so much, and I feel like healthcare cannot be smooth without those things, and the overarching thing I'm hearing as I listen to the journey you just described is how in the world is that possible without systems and pathways, right?
Absolutely. So, I think it's that great balance between understanding systems and that really healthcare is a complex system. And if we treat it like a simple system that we think we're able to just get simple results, it's not going to be able to help us to achieve what we're really looking to do. So, how do we recognize all those different parts that make it a complex system, from the patient factors to the clinician factors to the tasks to the environment to the tools and technology, organizational factors as well? How do we kind of take that complete picture and be able to coordinate different ways to be able to address those unique needs to really create a clinical pathway?
Yeah, so I think my first big question I want to pick your brain on, especially for our listeners who are only familiar maybe with private practice setup in healthcare, what do you think is the simplest way to define a clinical pathway in some of these systems?
So, the idea of a clinical pathway is to take what we know are evidence based best practices and be able to help them to fit within your healthcare system or practice of medicine, to be able to understand and kind of take a systematic approach to understanding the needs of the people within the system, the needs of some of the other stakeholders within the system, and be able to look at where could there be potential barriers and how do you work within a team to be able to overcome some of those barriers, to make it easy to do the right thing for patients and make it more challenging to do things that may not be in the best interest of the health and well being of the people we care for.
Yeah, and obviously that's very important in a hospital system. You're dealing with a very large number of patients, a very large number of providers, and then you feed into the admin roles that exist, all these different departments. I'm definitely curious to see what your experience is being in that space. How do you think that this kind of idea could help those private practice healthcare providers? I mean, obviously it would be a different level, but I still think systems are so important. How do you think it could benefit the small practice?
Two areas that I think are really great examples of that are the management of back pain with early contact providers, of thinking about how people enter the system with back pain. We know that 80% of us will experience back pain over the course of our lives. So, those early decisions, how we talk to patients, how we have some of those conversations, can have big impacts on others within the system. So, whether that's related to potential HEDIS measures that you're tied to in terms of performance, the impact on patients, what it can mean for downstream referrals within the system, to what it can mean for cost, can have a huge impact. So, even though it may be something that feels small within the outpatient setting, there are huge downstream implications for our patients and for the broader healthcare system as we think about that. So, that's a great opportunity and a great place to be able to utilize clinical pathways to bring patients into decision making, to make sure your teams truly understand the importance of avoiding unnecessary imaging early on in the back pain journey, and getting people the support that they need. The other place that I think about, so important within urgent care settings or primary care settings, as well as antibiotic stewardship. We know that we still have great opportunities, that antibiotic resistance is a public health emergency. But in that moment where somebody's coming in and asking for an antibiotic for some upper respiratory symptoms where it may not be indicated, each and every one of those moments can have a huge impact within that broader system too. So it's a great place to build clinical pathways of thinking about how do you educate your patients, how do you educate your teams as well as your clinicians, how do you build it in to do the right thing to prevent some of those unnecessary prescriptions that have an impact on health and well-being, but also have an impact on some key clinical quality measures as well that can have an impact back on your reimbursement for your practice.
Yeah, you closed it perfectly. I was just about to say it sounds like it benefits literally all parties. So the practice or the hospital will benefit from having some kind of organization to the chaos of healthcare, right? Like knowing what is responsible in your world as the physician, but also understanding what the patient involvement is going to look like. It also benefits the patient because they're going to be getting the quality care that they actually deserve and results outcomes. I love the way this sounds. And then, of course, that last piece that is a popular thing to remind physicians of. This also improves the revenue stream of the practice. You're going to get the results, more patients are going to come, you're going to get that reputation for doing this. This stuff really matters. You're a part of the bigger picture. It is no longer just you alone and your patients. There's no longer, I feel like, those little mom and pop bubbles. There is just so much more to the spectrum of care. Wouldn't you agree?
Absolutely. We are so connected across our practices and how we integrate with the bigger healthcare system, even places we don't necessarily think where we're intersecting. And an area that's always been of interest is employers. So, we spend most of our days at work. Our employers really help to support and supplement the cost for our healthcare as well. It's important to them that we're doing the right thing, that we're doing something that delivers high quality and a great experience at the lowest cost and makes our workforce healthier. So, it's just amazing all the interconnectedness and how we just, even as individuals, can make an impact.
Yeah, very valuable. Now, are there some technology companies or softwares that really stand out to you that seem to have been pushing this drive more in the healthcare space? Does anything stand out?
The opportunities to look at how that technology and clinical pathways helps to kind of connect all the stakeholders within the system, from the payer connections to the employer connections to patients to clinicians, and making that impact to make sure that we're all really singing off the same sheet of music, that we're talking about the same things, and that people have the same knowledge and background to be able to make some great decisions. I think there's a lot of amazing clinical decision making tools that are out there as well, that help clinicians have the right information in the palm of their hand to make decisions in terms of evidence based best practices. So, some of the CDC tools that are out there that allow you to have some of those decisions in real time to say, you really don't need that MRI today for your back pain that you've had for a couple days. You really don't need that antibiotic for the runny nose that you've had for a few days. And here's some information, and here's what we're really looking at as some clinical evidence about what's the right thing to do in this moment and what may not be the right choice.
Yeah, I love that. It also makes me think, of course, of the movement toward AI and how a lot of these companies are trying to use that, right? And kind of mesh it all together with clinical expertise, but also just a little hand holding, if you will, just to kind of remind us what to do and what not to do. But I've seen some really cool new EMRs or EHRs even that are having some AI built in where, if you're suspecting that that patient might have diabetic neuropathy, it can remind you like, oh, you should order this test. You should do this XYZ thing. And maybe we'll remember a couple of them, but it can help us, make sure we're on the correct path, I should say.
Absolutely. No, I think that's a great call for some of that clinical decision making AI support in an area that's definitely going to continue to evolve. And it'll help us to make connections across the system too. So, those suggestions of what might be the next step to consider, as well as how does that tie potentially to coding. We think about coding as a billing tool, but coding is really also an information tool of how we're able to share information across different stakeholders to understand how sick a population is, where there may be potentially more needs, and the more opportunities to connect different resources. So sometimes it feels like, oh, it's kind of painful, it's documentation, it's just another step or another click, but it's really a way to help ensure that we understand what's happening with population health and can get people the resources that they need.
Wow, I have never considered coding being used for data tracking. So the next time we complain about that section of our charting, we need to remember that it serves a deeper and bigger purpose.
That helps us to understand. And I think as we move more into risk adjustment, not only in Medicare, as we're looking at it in other spaces like safety net populations as well, it'll really help us to determine where there can be potentially more needs and where we may need to build new programs or deploy new resources.
I love that. When we talk about these systems, I feel like my brain completely views it as positive, positive, positive. And I get almost naive in thinking, this is such a beautiful thing. This must be so easy to implement. But I'm sure it comes with challenges. So I would love to pick your brain on maybe some current barriers to this concept. What are we faced with, especially in the hospital space, that could be preventing this from developing as quickly as it should?
So, it's still resource intensive. So, whether that's a tools and technology resource and making sure we're deploying things well, as well as having the people expertise that we need on the team to make it successful. So, when I think about performance improvement or systems work, it's really its own kind of specialty that there are people who bring that subject matter expertise to the table, who are able to convene people, have some of the right conversations, and make sure that we're managing projects and creating the right solution to the problems that we're identifying. I think sometimes for us, particularly as clinicians who, hey, get me a gram of vancomycin IV now, and don't necessarily see that bigger, broader system that kind of wove together to give us that medication in that moment that we're able to just call for. Sometimes, as we're doing some of the system work, it can be challenging to understand that why don't I have a solution for this now? It seems like an easy fix. But because it's a complex system, the solution isn't always easy. So I think making sure that we bring those subject matter experts who help us make that work easier will help us to create some of the solutions. It takes time. It's not a quick win fix that we're sometimes looking for.
Yeah, I'm curious to hear your thoughts on schooling and training with that. Because when I look back, especially to my own training and possibly med school, even, is there any kind of this education being given to our students about the back end work and how some healthcare systems work?
So I think it's definitely getting better over time than back when when I went through training as well. Uh, but I think there's still a lot more to come in terms of how that integrates in the future. I had the opportunity to work with a health system that was invested in that, and we had our residents go through Lean Six Sigma Yellow Belt training so that they were able to understand some of the processes and what went behind process improvement. So I think educating everybody on the team with really some basic performance improvement skills and then bringing on some subject matter experts who are able to help kind of guide through some of that through some project management work and some performance improvement tools makes all the difference too so that we're really speaking the same language of navigating through some of these complex systems.
Yeah, I love that. The sooner the better, too. Getting the young providers immersed into that's probably going to help push the needle even further.
Absolutely. And I do think you're right too, of making sure that folks understand some of the economics behind healthcare and how resources flow is so helpful. It can help to kind of mitigate some of the frustrations. It also helps you to to figure out, well, how do I navigate this challenge that I'm seeing? How do I take all the great clinical experiences that I've had, those moments at the bedside that are so meaningful with our patients? And if I understand the broader system, I can help to navigate and help non-clinicians better understand, where we can connect new resources to get patients what they need.
100%. So, for our listeners that are less familiar with this topic, can you maybe give us a couple of very specific examples that you have seen work really well when a true system, a true pathway has been implemented? You mentioned a little bit about the low back pain, but how about like a specific emergency department situation, maybe?
So one place that I saw in the health system where folks came together and spoke differently was when we started to build clinical pathways around urinary tract infections. The pediatricians had already kind of come together and understood well some of that clinical pathway work. I know that CHOP has done a great job of putting online some clinical pathways that they utilize as well. So our pediatricians started to go there. But one of the things that they noted was maybe the emergency department was doing things a little bit different, or family physicians were doing things a little bit differently. And there was some natural kind of frustration there, like what's happening. But when those
Mhm.
teams came together and started having the conversation and were able to pull some of their specialty specific literature together, we were able to create a better understanding across teams of where people were coming from to be able to build a pathway that made sense for the system and for the different teams within the system too. Gosh, it feels like they're doing something differently than us. And how do we bring them together to have some of the conversations differently?
Yeah, it sounds a lot like finally implementing teamwork, not only within the same specialty, but also interspecialty. I feel like most people are on board, most people are receptive to that education. What about that tiny percent that's not? What about those providers that are just not open to changing some of their systems or even beliefs when it comes to diagnosis and treatment? Have you encountered anything like that before? And how can we mitigate that?
Absolutely. And so I think that it's that really kind of fundamental work of figuring out the systems and also working on the relationships too. So, in order to do this work well, you need to kind of create those systems of developing psychological safety and trust also, and figuring out where there are places where people are feeling unsafe in those conversations. What are some of the barriers, addressing those in some of the relationships? And then from that work, you can combine the systems work and then the relationships to help it move forward. If we can help with coaching and mentoring to help kind of create some of that psychological safety and trust, it's fantastic. I think there are some people who are just not, aligned with this kind of work, or not aligned with that. And maybe they're not really the best fit for the system, too. I mean, we want everybody at the table, we want everybody participating also. I think finding that right balance, trying to bring people along with some coaching and mentoring, and figuring out who may not be a good fit if you're looking to really kind of drive and advance healthcare in this way.
I would really love you to touch base on what you do in that space as we close here, because I feel like a lot of people who might be listening to this are wondering how to get started or how to learn more. And some of the tools and training and skill sets that you've mentioned, how does one even obtain that? So if you could tap into your work as a consultant and a coach and just let us know what options exist, I think that'd be great.
Yeah, so I have really enjoyed my time as a consultant and coach in working with different companies. So sometimes that's just bringing in my expertise of working across health plans and health systems, in some of the performance improvement work, and helping to address a specific question or challenge that somebody has. And that generally comes through some of the consulting work. With coaching in mentoring, that tends to be a little bit more one-on-one work that I have with individuals. As a mentor, the role of a mentor is really to work with somebody to bring some of those skills and tools that you have as an individual. As a coach, I have the opportunity to walk more side by side with individuals too, where I'm not necessarily giving the answers to the challenge, where I'm helping them to really kind of think through what they're experiencing, asking questions with our different 22 coaching tools that we're able to deploy along the way to help people come up with the solutions to their own challenges. So, consulting versus mentoring versus coaching, they all look a little bit different. Sometimes we can weave them all together in an engagement and working with people, but it's definitely really fulfilling work. It gives me the opportunity to intersect with individuals in different areas to help make an impact.
I love the reminder that this exists. There's so many other professions and fields that can have a specific coach or therapist that specializes in their realm. Maybe it's the financial realm or the business realm or even education. And I think we forget as healthcare providers that we can also benefit from this kind of stuff. So I love the reminder that it's out there and we can all benefit from having someone side by side with us as we grow throughout our clinical careers, throughout our non clinical careers, even because think about how much we change as providers, like every 3 to 5 years.
Absolutely. And it really, I mean, as it grows exponentially more complex to be in healthcare, having people that you're able to walk side by side with, that you're able to have additional support as you navigate, is so helpful. And, there's always that saying that leadership is lonely at the top. and having a trusted person who's able to work with you since you can't go back and talk around the lunchroom table about everything that you're feeling or experiencing, but having somebody who you're able to do that with can make a big impact.
I agree. I love that. Thank you so much for sharing. And to wrap up this episode, if you could just close by giving us some examples of what you worked with Spine Care Partners. As you know, they are the ones who produce this podcast. And I know that you've done some pretty incredible things with them. And I would love for you to just give us an insight as to what that work looked like for you.
Those spine care partners, the work with that team is really what helped to introduce me to that difference between clinical guidelines and clinical pathways, and that importance of balancing not only what we do, but how we work across a team, how we build relationships. I had the opportunity to work with them in upstate New York in some of our work at Blue Cross Plan and working across different practices and ACOs to be able to create some clinical pathways. Also had the opportunity to work with Spine Care Partners in some work in Rhode Island to look at how we could improve quality and reduce cost in spine care, and some of the work that they did in Michigan and forming some of the Michigan collaboratives around spine care, which I think is really phenomenal, is creating those collaboratives where we bring people together differently, have the conversations around those evidence-based best practices, look at the system barriers together and address those barriers together. So I think they do amazing work to help ensure that we're doing right by people in the area of spine, that we're making sure people are able to live their best lives with back pain. So, highly recommend the work of Spine Care Partners.
We appreciate it. You are actually the first guest interview we're having on the newly rebranded show. So we are just so thrilled to have you. And I can tell you're passionate about this topic, and just try to remember how it ties into the big picture. You know, the improvement of patient outcomes, the improvement of quality of care, the collaboration piece, and following these evidence based standards, regardless of what specialty you're in. There's just so much to unpack here. So, Dr. LouAnne, I just thank you so much for joining us today for the show.
Well, thank you so much for the opportunity to speak with you today.